Hello and welcome. I am so thrilled to give you this overview of the ID Fellowship program at UCSD. I'm Darcy Wooten, the Fellowship Program Director. So this presentation, I'll be giving you a brief overview of our fellowship, and I'm going to touch on some of the curricular highlights, talk about areas in which our fellows do mentored research projects, and then finally come to the most important aspect of our fellowship, namely the people, including our mentors, our faculty, and both current and graduated fellows. We really see our fellowship as a springboard for fellows to really gain the knowledge and skills that will allow them to become future leaders in ID. And our mission is all about you. It's very fellow centered. So we've designed our fellowship to really support your career development so that you can achieve your career goals. And we do this through outstanding and diverse clinical, educational, and research training experiences. Within our fellowship, we have two tracks. The clinician educator track is a 2-year program and is offered every other year. And since it's not offered for the 2021-2022 recruitment season, I'm not going to spend too much time reviewing this track. The other track is our research track, and this is a 3-year fellowship in which fellows will spend the first year primarily participating in clinical rotations and a longitudinal ID clinic. And then in the second and third year of the research track, fellows are predominantly working on mentored research projects, but also do some time on the clinical consult services as well as their HIV continuity clinic. So I want to start off by reviewing the clinical training in our program, which I think is just absolutely outstanding. We serve an incredibly diverse patient population, and our location on the border with Mexico really provides for the opportunity to see some unique patients and infections. We have a 3-hospital system, which also provides for very diverse training. So the Jacobs Medical Center, which is part of UCSD Health, is located in La Jolla. And here, fellows see infectious complications related to many of the surgical subspecialties, solid organ and bone marrow transplant, OBGYN, and this houses our advanced cardiac and cardiothoracic care center, so seeing infections related in those areas. There's 3 ID consult services at Jacobs in which fellows rotate: the general ID service, the solid organ transplant ID service, and then the oncologic ID service, or ONC-ID for short, which sees many patients who have undergone bone marrow transplant. The Hillcrest Medical Center is down south, and this really gives fellows an experience in treating infections that are prevalent among marginalized and underserved patient populations, including patients with HIV and/or substance use. There's 2 consult services at Hillcrest, the General ID service and our HIV medicine consult service. Our 3rd teaching site is the San Diego VA Medical Center, which is located just next to the medical school and then about a stone throws away from Jacobs Medical Center. So at the VA, you get a lot of bread and butter ID experience, as well as opportunities to learn in depth about antimicrobial stewardship, infection prevention, and quality improvement as it relates to infectious diseases. So this slide shows sort of an estimate of the breakdown of, where fellows will spend their time on the clinical services during their first year. And this includes about 6 months on general ID at the VA, Hillcrest, and Jacobs, and then about 1 month each on the solid organ transplant ID service, BMT ONC ID service, and HIV medicine ID service. We also have an antimicrobial stewardship, infection prevention, and quality improvement rotation at the VA, where fellows spend about 3 months. And this rotation really gives fellows the opportunity to learn things like leadership skills and quality improvement skills and research analytics skills. And it also gives them a little bit of downtime from being on call. And so they can start to plan for their upcoming research years. Fellows during this first year will also do a half day a week at an ID clinic, and they'll attend the ID clinic that correlates with whatever inpatient service they're rotating on. So the second and third year in the research track are really primarily focused on research, but fellows do some advanced clinical training during these years as well. So fellows will rotate for 2 weeks at a time on 3 ID services of their choice based on their interests. And then fellows also participate in a weekly HIV continuity clinic, either at the Owen Clinic, which is our HIV primary care clinic on the Hillcrest campus, or at the VA in the Special ID Clinic, which is the HIV continuity clinic there. So beyond the clinical rotations and patient-based education that we also have a number of curricular threads that take place throughout the fellowship. We have a 2-year ID core didactic lecture series that takes place on Tuesday mornings. Our microbiology curriculum includes both a 2-week rotation actually in the lab during the first year. And then fellows also attend micro rounds or micro didactics 3 times a week. At the UCSD Health hospitals, they do this by Zoom because the micro lab is off-site. And here, the micro directors will review cultures, slides, other diagnostic tests, usually for active patients who the fellows are following on the consult services. Fellows, as I mentioned before, also spend 3 months at the VA on our antimicrobial stewardship, infection prevention, and quality improvement, where they'll have a combination of both didactics as well as hands-on learning in these areas. And then all of our second year fellows participate in our HIV clinical curriculum, which really helps to complement their learning in HIV continuity clinic. And then we have a number of elective curricula that our fellows can participate in after their first year, if it fits with their career goals and career development plans. We also have a couple of additional conferences that I just want to highlight, including our weekly ID Grand Rounds and Case Conference and our weekly HIV and Global Health Grand Rounds. We have a number of HIV clinical conferences, which are listed here. And then we have our research conference, which fellows present their research works in progress, as well as their career development plans at our biannual research guidance committee meetings. And during these sessions, it's really great. Fellows receive guidance, support, and feedback on their research projects from a panel of experts outside of their own primary research mentor and mentoring teams. And then finally, the program leadership meets frequently with all of the fellows as a group, as well as individually, to get feedback on the program and see where we can make improvements. So I want to spend a little time describing the areas of research where our fellows conduct their projects during fellowship. Research fellows in our program are all supported by NIH funding through our T32 training grants. We have 2 primary and 1 associated T32 training grant, which support our fellows. And these include the antimicrobial resistance T32, the HIV and other global pandemics T32, and then the third T32 really focuses on public health with an emphasis on HIV syndemics, which includes both epi and behavioral health research, looking at the intersection of HIV, substance use, mental health disorders, and risks of other infections. So the antimicrobial resistance T32 is led by Drs. Nizay, Smith, and Liu, and fellows supported on this T32 do primarily basic translational or clinical research in one of the following areas. So deciphering microbial virulence, host defense and vaccinology, new drug or therapeutic discovery, microbiome science, systems biology and engineering, and finally, clinical microbiology and therapeutics. So here are some examples of fellow projects who were supported by this T32. We've had fellows do basic research on Staph aureus bacterial pathogenesis, clinical and therapeutics research on Chagas disease, clinical and hospital epidemiology research on drug-resistant infections in patients residing in long-term care facilities, basic science research on bacteriophage biology, as well as therapeutic research looking at the use of bacteriophages for multi-drug resistant organisms, including in specific patient populations, for example, looking at patients with resistant LVAD infections. And finally, a current fellow working on infection prevention strategies to mitigate COVID-19 transmission among healthcare workers. The HOPE T32, which is how we abbreviate the HIV and other pandemics T32, supports fellows who are doing research on HIV, COVID-19, and other pandemics, and is led by Drs. Gianella, Latendra, and Guatelli. Fellows really do wide-ranging research on this T32, everything from basic and translational research to clinical and epidemiologic research, focusing in one of the following areas. So reducing HIV incidence, HIV treatment, including HIV cure research, HIV-associated comorbidities, co-infection, and complications, health disparities in HIV, and then finally COVID-19. So here's some more examples of projects that fellows who are supported by this T32. So we've had fellows work on the pathogenesis of HIV and cardiopulmonary disease, HIV pathogenesis itself with looking at the reservoir and HIV cure, more sort of epidemiologic research, looking at HIV incidence and disease transmission modeling. One fellow actively working on the adaptive immune response and studying that response to SARS-CoV-2. And then finally, another fellow actively working on dynamic infectious disease modeling to evaluate public health interventions and assess their economic impact. So quite a variety of projects, as you can see, everything from bench to clinical to public health. And then finally, we have our associated T32 looking and focusing on HIV syndemics, which is led by faculty in global public health, including Drs. Martin and Strathi. And research related to this T32 really takes more of a behavioral, epidemiologic, and public health approach, primarily looking at the overlap of infections which are impacted by structural barriers such as substance use, mental health disorders, racial ethnic disparities, socioeconomic factors, et cetera. So opportunities for fellows interested in more of a different type of methodology and approach could be supported with this T32. So for our fellows who are doing clinical research, we have a really nice curriculum in clinical research called the CREST program. And fellows can take this structured coursework in the areas listed here to develop their research skills to carry out clinical or epidemiologic research. These are really popular courses, and our fellows work with the program leadership as well as their research mentors to kind of pick and choose which courses will be most helpful and make the sense for fellows to participate in. Some of our fellows don't take courses in the CREST program, but many do. Mentorship, of course, is a foundational component of our fellowship program. The program directors really serve as longitudinal mentors throughout the fellows' time in the program. And we also actually meet with fellows before they even start fellowship in July to start exploring their career goals. And we, even before they get here, pair them with a first-year career mentor who will meet with the fellow frequently during that first year to check in, help them adjust to UCSD, and also start to explore sort of potential areas of interest for research projects and ultimately career trajectories. And so during that first year, we help the fellows identify a primary research mentor so that when they start in their second year, they can really hit the ground running and get started on their research projects. In addition to their primary research mentor, with whom obviously the fellow will work very, very closely with frequent weekly meetings and a lot of oversight, we also establish research project mentoring teams, often with support and guidance from the Research T32 leadership to help provide sort of a well-rounded mentoring team to help the fellows with their research projects. And then finally, we arrange for peer-to-peer and near-to-peer mentoring among the fellows themselves so that they can really learn from each other and have opportunities to convey their experiences and bond with each other as well. So I want to highlight some of the core faculty in our program with whom you'd be working. In addition to serving as the program director, I am also the Hillcrest site director. Dr. Nancy Law is our associate program director of clinical affairs, and she serves as the site director up at Jacobs. Dr. Mary Lewinsky is our Associate Program Director of Research, and she serves as the Site Director at the VA. And then finally, Meredith Lococo is really the glue that holds our program together, and she is our fabulous Program Coordinator. I've listed some of the other leaders within our division, and you'll likely be interviewing with some of these folks and working with them either in a clinical or a research capacity during fellowship time here. So I just want to wrap up and sort of discuss what I think are the main strengths of our program. So first, we really have just outstanding clinical training. And I think this is because of the diversity of our patient population, our clinical training sites, but also really the absolutely outstanding clinician educator faculty within our division. We also have incredible research training experiences due to our diverse, accomplished, and accessible research mentors. Within the Department of Medicine, our division brings in the most NIH research funding, and we have research mentors who are doing cutting edge research across many different fields in which fellows can be involved. We have several structured curricula in our fellowship, and these can also be customized to fit your unique learning goals and career development plans. And fellows have ample opportunity to teach and improve their teaching skills by working with medical students and residents on the wards, in clinic, and even in more formal settings like in the classroom. The degree of collegiality is really something that is unparalleled here among not only our fellows, but also within our division itself. We're just such a very close-knit family. And then finally, the quality of life in San Diego with the weather, the beautiful outdoor activities, the food, the culture, it really just makes for a well-balanced, very restorative and inspiring place to train. But I think probably what I'm most proud of is the success of our fellow graduates, which is shown here in this pie chart. So approximately 70% of our graduates go on to stay in academic medicine, either at UCSD or other academic medical institutions, doing a variety of things from clinical work to healthcare leadership to cutting edge research. About 20% of our fellows have gone into public health and 11% into private practice. So we're really committed to helping each of our fellows gain the skills and expertise that they need to really achieve their career goals and to achieve high career satisfaction. So I want to just thank you so much for your interest in our program. If you want any additional information about our program, the ID division, UCSD, please check out these links, which hopefully will provide you with more information. I want to wish you all the best as you move along your path in really creating your ideal ID career. And I hope to meet you and further explore your career interests. Thank you so much.